unicondylar or partial knee replacement? What is the concept of unicondylar or partial knee replacement? Is it half knee replacement?
Well, it has been decades that we have been doing knee replacement surgery. But then, with time, the scientists, the doctors recognized certain points. One of the most important points was that in several cases, the arthritis is only on the anteromedial part of knee. What it means is that the knee joint has three compartments. One is the medial compartment, other is the lateral compartment, and third is the patellofemoral compartment. So in several cases, we see that the arthritis is only or restricted to the medial compartment of knee, and that causes severe pain. In those cases, we thought that instead of replacing the whole knee, let's replace only the medial compartment. This is known as unicondylar or partial knee replacement. Now this is not a half knee replacement. This is a concept which is different from total knee replacement. This is not a half knee replacement. This is technically more demanding. This surgery came after total knee replacement, and this is a more advanced surgery. The advantages in this unicompartmental or partial knee replacement is that it's absolutely minimally invasive surgery. Just 1 inch cutting is required. Second, it preserves the internal cruciate ligaments of knee. That is, it preserves the anterior cruciate ligaments and the posterior cruciate ligaments of knee. It preserves the natural femoral rotation. It preserves the natural femoral rotation, the natural patellofemoral mechanism. Thus, it gives a feeling of much more natural knee to the patient. The patient, after a month or so, will feel that nothing was done to his or her knee at all, and it allows for very higher degrees of activities like playing sports or even sitting on ground.
What are the advantages of unicondylar or partial knee?
The advantages of unicondylar partial knee replacement is that first, it is a minimally invasive surgery. The cutting is 1 to 1.5 inch. The recovery is very fast. A person after unicondylar knee replacement can be discharged the very next day of surgery. And even in certain cases, we have done it as a daycare surgery. The surgery has been done in morning, and by night the patient has been discharged. So, and the recovery after surgery is very fast. Normally, people after unicondylar knee replacement can join office by 2 weeks of surgery. And the biggest advantage of unicondylar knee replacement is that it feels more like a natural knee. A person after several months of surgery would never remember even that a surgery has been done to the knee. The person is able to sit down on ground, person is able to get up from ground, and all these activities are better than a total knee replacement. But then, not everybody can undergo unicondylar knee replacement. There are certain stringent guidelines which has to be sufficed for doing a unicondylar knee replacement. Otherwise, still majority of the times total knee replacement is done.
Can it be done minimally invasive?
Yes, a unicondylar knee replacement is a minimally invasive surgery. The cutting is 1 to 1.5 inch. The quadriceps muscle is preserved, and we have selective new instruments which are known as microplasty instruments, which have made it even more minimally invasive to the extent that certain cases can be done under daycare surgery also.
Can the person walk on same day of surgery?
Yes, after unicondylar knee replacement, several cases we have done surgery in the morning, and by evening the patient walks. Now why he walks by evening is that the cutting is very less, the thigh muscle which is known as quadriceps muscle is preserved, it is not cut, and we managed to keep the person absolutely painless. So after a unicondylar knee replacement, the person can walk the same day of surgery by evening.
Can he be discharged the next day?
Yes, after unicondylar knee replacement, patient can be discharged the next day of surgery because it's a minimally invasive surgery. There is minimal blood loss, there is almost no pain, and the recovery is really fast. And why the person can be discharged next day is that it is done under absolutely local anesthesia. What it means is that we do not need general anesthesia, we do not need spinal anesthesia. We can do the whole surgery under a combined femoral nerve block. So because of that, the patient is absolutely stable, and the person can be discharged the very next day.
Can a person sit on ground after partial knee replacement?
Yes, partial knee replacement, as we had just discussed, it's a much more physiological surgery in which all the four ligaments of knee are preserved. The knee has got two external ligaments which are known as collateral ligaments, and two internal ligaments which are known as cruciate ligaments. Now the cruciate ligaments are very pivotal for the stability and the natural biomechanics of knee. So in the biggest advantage of this partial knee replacement is that the cruciate ligaments are preserved, which is or let's say the anterior cruciate ligament is preserved, which is not preserved in general total knee replacement. So a person can sit on ground because it is biomechanically more stable than total knee replacement.
Is it more technically demanding surgery?
Yes, unicondylar knee replacement evolved after total knee replacement. The surgeons trained in unicondylar knee replacement are very few, and it is a technically more demanding surgery, more advanced surgery. That is one of the reasons why unicondylar knee replacement is not, you would not hear it from every surgeon's mouth. Total knee replacement is done by more surgeons. It is more commonly performed surgery. Unicondylar knee replacement is technically more advanced, more training is needed, and not everybody does it.
When partial knee replacement cannot be done?
The question you would like to ask me is that why don't I do partial knee replacement in every case then, if it is a better surgery? Well, partial knee replacement cannot be done in every case. For a knee to undergo partial knee replacement, there are certain criteria. One of the most important criteria is that the knee ACL or the anterior cruciate ligament should be intact and it should be preserved. Along with that, the arthritis should be limited to medial compartment, and technically something which we call is correctable varus. What it means is that knee should not have been bent too much before surgery. If the knee is bent too much before surgery, then partial knee replacement cannot be done. That is one of the reasons why partial knee replacement is done less in our society, because a lot of people come in pretty advanced stages of osteoarthritis when knee is considerably bent, and then partial knee replacement cannot be done. Then we have to opt for total knee replacement.
Who are the best candidates for partial knee replacement?
Partial knee replacement, the best candidates are people who are young and active, who want to pursue relentlessly active life, and people who get the surgery done at correct time when the knee is not too bent. Those people are the proper candidates for partial knee replacement, because this gives more degrees of freedom than total knee replacement.
What are the implants for partial knee replacement?
Well, partial knee replacement implant that we most commonly use nowadays is something called Oxford knee. Oxford knee is also known as mobile meniscal bearing knee. Meniscal bearing knee or Oxford knee is the most commonly used implant for partial knee replacement. Other knee replacement implants like Aesculap partial knee replacement implants are there, and there had been certain partial knee replacement implants which had been recalled, and presently the most commonly used is the meniscus bearing partial knee replacement implant.
What is accelerated recovery after partial knee replacement surgery?
Well, recovery after partial knee replacement is really very fast. Person walks on the same day of surgery and gets discharged on the next day of surgery. And a person who is going to office should be able to join office by 12 to 14 days or maximum 2 weeks of surgery. And a person who wants to travel can travel by a month after surgery. So this recovery is faster than total knee replacement. Why it is faster than total knee replacement is because the cutting is less, the quadriceps muscle is preserved, the muscle is not touched at all, and it is much less, it is very pain-free surgery, and this speed of recovery after partial knee replacement is called accelerated recovery after partial knee replacement.
What are the level of activities after knee replacement surgery?
Well, partial knee replacement surgery allows for slightly greater levels of activities than total knee replacement surgery. It can allow a person to sit on ground also, it can allow a person to do cycling, swimming, and play non-contact sports as well as driving. The level of activities are more or less same as total knee replacement, but still it gives slightly more degrees of freedom. But even after partial knee replacement, squatting should be avoided.